We want to turn now to the growing mental health crisis facing America's children. The most recent CDC data revealed a troubling trend that 3 in 5 teen girls felt persistently sad or hopeless. To get some advice for parents, we sat down with a top psychologist and the author of the new book, The Emotional Lives of Teenagers. Ishika Vij was just 12 when her anxiety started. After feeling the pressures of her schoolwork, Ishika developed an eating disorder.
Just being able to control how I look versus I thought, I wasn't worth enough or smart enough. So I was like, maybe I can be pretty enough, or I can, follow these norms that social media has set.
This is a different generation. Their ability to cope with things is way different. They're all resilient, but I think they're just exposed to a lot more things much earlier than we ever would have thought.
Lisa D'Amour is a clinical psychologist and mother of 2. She says parents should delay and limit their children's access to social media.
When girls are in distress, they tend to collapse in on themselves, whereas when boys are in distress, they tend to act out.
How do we help teens deal with those ups and downs?
We approach it from the side of what we call emotion regulation. So you can't get rid of distress, you can't keep it from arriving, but you can regulate it. Getting feelings out, as teenagers say, is part of how they get relief.
Ishika didn't have that outlet with her parents. It was only when she had thoughts of suicide that they began to realize the severity.
A lot of parents have the not my kid attitude. Like, my kid, he's not like your kids, or my kid's better.
You don't see it even when it's hiding in plain sight. When you look back, you see the symptoms and you could say, hey, these were all there. But while we were going through this, we just didn't realize it.
Knowing the signs is the first step. Experts say parents should keep an eye out for a sudden drop in grades, self-isolation, a short temper, and changes in eating or sleeping habits. You say teens need 2 things for healthy development. What are they?
Well, what they need is the warmth and structure. It's harder sometimes with teenagers. I would say the #1 rule for raising teenagers is don't take it personally.
After months of intensive therapy, Ishika is in recovery, and now the family speaks openly about mental health.
Your job as an adult, as a parent, is to be there for them and support them, and creating a positive support system, even if you don't completely understand, it means a lot, and it can be a really, really big impact on their lives.